Welcome to Weekly Digest, where we highlight the works of ministers of government as they push the administration's development agenda. Work will begin soon to construct a specialized pediatric and maternal hospital along the East Coast Demerara corridor. The sod was on Sunday last turned for the future low-rise facility, which will cost some €149 million. It is set to be constructed at plots 7 and 8, Plantation Good for Wacton, East Coast Demerara. The modern hospital will have 256 beds and will cover some 24,000 square meters gross floor area. Health Minister Dr. Frank Anthony said the turning of the sod signifies another era of public health investment in Guyana. He added too that the milestone clearly demonstrates President Dr. Mohamed Irfan Ali's vision of building a world-class health facility is more than talks.
It would be the largest public health investment in the entire history of Guyana. And in the times when countries are affected by COVID and many economies are down, we are making these bold investments in our country for our people to make sure that they can get the best health care.
Minister within the Office of the Prime Minister with responsibility for public affairs, Kwame McCoy, on the occasion of Emancipation on Monday, urged Guyanese to use the freedom they currently enjoy to bring unity and oneness. He was speaking during celebrations held at Soesdijk, East Bank, Demerara.
We must not use the freedom to deny the rights that others should be enjoying. We should use the freedom that we have to make sure that we can find ways around. In fact, using the lessons of our foreparents, the struggles that they took to the movement, the slavery movement, or against the slavery movement, those lessons should be used to make us a better society and a better people.
Minister McCoy reiterated government's support for initiatives that will contribute to community enhancement and individual wealth. He pointed out that the PPPC government will ensure all citizens have access to equal opportunities regardless of gender, ethnicity, or location. Some 52 households in Pigeon Island, Chatamargo, East Coast Demerara will soon receive their certificate of titles for lands they have been illegally occupying for years as the Central Housing and Planning Authority moves to regularize the area. Minister within the Ministry of Housing and Water, Susan Rodriguez, made this announcement during a cabinet outreach led by His Excellency Dr. Mohamed Irfan Ali on Tuesday. Originally, the area fell under the National Industrial and Commercial Investments Limited, NISIL. Prior to 2015, when President Ali served as Minister of Housing, he had ordered a review of the area with a view to regularizing the squatter settlement.
The Central Housing and Planning Authority has approached NISIL, who is the owner of that land, and it is already in process of being transferred to CHPA. As a matter of fact, the vesting order has already been published in the official gazette, and the Central Housing and Planning Authority will be in receipt of that block transport in about 2 weeks' time. Then we can subdivide the area and we will be able to distribute the long-awaited land titles in the squatting area. We have 52 structures that are there, 52 occupants, and they will receive their land titles before the end of this year.
More than $6 billion was packaged and sent to schools across the country as the Ministry of Education kicked off its Because We Care cash grant distribution on Tuesday. Thousands of parents were seen assembling to partake in the smooth, efficient process that was being facilitated by ministry officials. Various cabinet ministers spanned out across the country to assist in the distribution of the $30,000 grant. At Queen's College in Georgetown, Senior Minister within the Office of the President with responsibility for finance, Dr. Ashni Singh, posited that the distribution of this grant is only one indication of the fact that government is positively targeting young people.
There has never been a better time in the entire history of our country, since our country was first settled, There has never been a better time to be a young person in Guyana than this time. Not my parents, not my generation, not my parents' generation, not my grandparents' generation. You know, we all look back and we say, you know, the good old days, you know, when I used to go to school, schools were the real thing. You know, we all say that, you know, all parents, all grandparents, you know, in my time. I see a lot of people smiling. I want to repeat what I said. There has never been a better time to be a young Guyanese person than this time in which we are living. Why do I say this? Guyana is undergoing a remarkable transformation. Remarkable transformation. Our economy is changing rapidly.
Over at Kurukururu on the Soesdijk-Linden Highway, Minister within the Office of the Prime Minister with responsibility for public affairs, Kwame McCoy, delivered brief remarks at the beginning of the distribution process at the Kurukururu Primary School. Some $52.79 million was distributed to students attending the Kurukururu nursery, primary, and primary top schools. Minister McCoy dubbed these grants as an investment in the lives of the children.
That's why we give support in many other areas in the education sector, along with which you, the parents, the mothers and the fathers, would chip in as your investment. And so we have a holistic and total package for the investment in our children's education.
Meanwhile, Minister of Public Works Bishop Juan Edgell took part in the distribution process at the Mackenzie High School in Region 10. The minister reminded that the increase in distribution of the Because We Care cash grant is the delivery of yet another promise by the People's Progressive Party civic government.
So today I stand here as a member of the cabinet representing His Excellency President Ali and all of us in the cabinet, including the Minister of Education, to say we are proud to be delivering on a promise we made.
The Because We Care cash grant, which was first instituted in 2014, was discontinued under the APNU AFC government. Upon its return to office, the PPPC reinstated and increased the grant significantly to better assist parents in delivering quality education to their children. A community development group will soon be established in the community of Melanie Damishana, East Coast Demerara. A ministerial team comprising Minister of Local Government and Regional Development Nigel Darmlal, Minister of Labour Joseph Hamilton, and Minister within the Office of the Prime Minister with responsibility for public affairs, Kwame McCoy, on Wednesday afternoon visited the community and did a walkabout assessing the roads in the area and meeting with residents. This was a follow-up to a 9-member outreach led by Prime Minister Brigadier Retired Mark Phillips to the community.
We have already made some decisions, one of which will be on Saturday. A community development group will be formed, and that community development group, we will work with the group to begin cleanup of Melanie Damishana. We also have to go on the northern side of the public road to meet with those residents as well, because they also have legitimate concerns and issues for us to deal with.
We're expecting to work with the community. From what we see here, there is some lack of leadership and coordination, but there is an interest and a willingness to move towards a good coordinating mechanism for the community, and so we are going to be working with residents of this community to guide them towards a community development group, and to make sure that we can work with them as the official partners link to the Melanie Damishana communities.
One of the issues they have here is NDCs, even though they fall within an NDC, NDCs, they have to be careful how they intervene because co-op societies are owned by shareholders who are the members, not government property, so to speak. And so that is one of the issues. So Sunday at 3 o'clock, we will have this conversation, and we hope coming out of that, we can put in place the framework to manage the place as regards the co-op society properly. The whole issues about accountability, transparency, auditing of the finances and all that kind of thing, and to see how many more programs we can do in the community.
Region 9 is leading the way in the vaccination of children aged 5 to 11 years. Minister of Health Dr. Frank Anthony, while giving the daily COVID-19 update on Wednesday, noted that since vaccination for this age group commenced in June, some hinterland regions are doing better than others.
First dose coverage in Region 9 is about 39.9%. So when you consider that the average across the country is 6.7%, Region 9 first dose is 39.9%, that's really good. But when you look at their second dose, they haven't done any second doses yet.
However, some time needs to elapse before the second dose is rolled out in this region. Region 8 is following closely with 36% coverage among the 5 to 11 age group, with 2.8% taking a second dose. Region 7 has a 4.7% coverage for the first dose, while second dose is 3.7%. Region 1 currently has 3% coverage with a second dose coverage of 0.3%. The Pfizer vaccines for children ages 5 to 11 were first introduced to the local population on June 11, and so far, over 6,819 children have taken a first dose of the vaccine, while over 1,967 have taken a second dose countrywide. Dr. Anthony is also urging persons who have had both first and second doses to take their booster shots, as so far only 71,000 booster doses have been administered. Minister within the Ministry of Housing and Water, Susan Rodriguez, a former pupil of the Ketley Primary School, on Thursday visited the school to overlook the distribution of the Because We Care in School Uniform and Supplies cash grant. Some $11 million worth in grants was distributed at the school.
As a government, we choose to honor our commitments, we choose to honor our promise, and we choose to invest in trust and to invest in the relationship that we have with our people. That's why this cash grant is so significant and so important to us. And we are a government about empowering you. Empowering you means giving you the means to make your own decision.
Minister within the Office of the Prime Minister with responsibility for public affairs, Kwame McCoy, also visited public and private schools along the East Bank corridor to overlook the distribution of the education cash grants.
You can see us making the investments in keeping with the priorities that are the priorities of our people. And one such investment is the investment in our children's education. Very important. So what you have is a partner in development, a partner in the development of your children's education, and an investment, though may not be as large as a government's or can match the government's resources, an investment that nevertheless is priceless and very valuable.
Guyana will be able to contribute to universal energy access, address energy security needs, and advance climate change mitigation efforts with adequate technological and financial support for the development and execution of solar energy projects. This was revealed by Prime Minister Brigadier Retired Mark Phillips, who was speaking at the opening ceremony of the International Solar Alliance 4th Regional Committee meeting for the Latin America and Caribbean region on Thursday.
Guyana is ready to engage and work with our fellow members, as well as the ISA Secretariat, to realize the ISA's goal of increasing the deployment of solar energy technologies while contributing to universal energy access, promoting energy security, and supporting low-carbon energy transitions.
The meeting facilitated dialogue among member states and ISA on strategic priorities and initiatives on solar energy development aligned with the goals of the ISA. Prime Minister Phillips spoke of the importance of such platforms which bring together policymakers and stakeholders to develop innovative solutions that will shape the regional agenda for clean energy transitions.
Guyana has benefited from the ISA's cooperation assistance in the areas of technical cooperation and grant assistance. Therefore, the government of Guyana looks forward to opportunities for greater collaboration as our country embarks on a tremendous transformation of our energy sector.
Guyana has benefited from the ISA's assistance in the areas of technical cooperation and grant assistance. The Prime Minister said the government of Guyana looks forward to greater opportunities and collaboration as the country embarks on the transformation of the energy sector. Also on Thursday, Guyana received 132 black-belly sheep, the first batch of 1,000 expected to arrive from Barbados as part of an agreement between the two CARICOM countries. Minister of Agriculture Zulfikar Mustafa was at the wharf to receive the sheep along with Prime Minister of Barbados Special Envoy to Guyana and Suriname Althea Wiggins and other local senior officers. The sheep include 112 ewes and 20 rams and will be under the care of the Guyana Livestock Development Authority to get them adjusted to local conditions before distribution.
I'm looking that in the other two shipments we can have all the 1,000 blackbelly to come to Guyana. You know, the President have announced that this program is a special program where we want to create a brand, a Caribbean brand with blackbelly here. And also Prime Minister Motley would have said when she was in Guyana that she wants to also she wants us to also breed a new breed of sheep, a mixed breed between the blackbelly and the Guyana local sheep. So we are looking to work in those two directions.
30% of the black-belly sheep will go to women and 20% to young people. Persons living with disabilities will also benefit.
This here will be a very important project for us in Guyana and the Caribbean. This is one of the ways we are working to reduce the food import bill. And when you look at the importation of meat and meat product in the Caribbean, it's among to a large percentage of foreign revenue and to import that. So we are hoping to build the livestock industry, and Guyana has to play that leading role.
On Friday, the Ministry of Agriculture, in partnership with the Inter-American Development Bank, launched its agriculture survey for Regions 2, 3, 4, 5, and 6 to the tune of approximately $25 million. This will see a number of prospective enumerators being trained to properly conduct these surveys with hinterland farmers. Minister of Agriculture Zulfikar Mustafa explained that a survey is critical in the development of the agriculture sector.
This here will help us to capture not only to do a survey among 4,000 farmers, but will also help us to register those farmers so that we now will have knowledge of what those farmers are producing, exactly what they are doing, and how we can set our program. Because when you set programs, especially in the agriculture sector, you have to be more realistic because we are dealing with food and food security.
Minister Mustafa noted that with proper knowledge and surveys, the ministry will be able to capture all farmers in government's initiatives. While Guyana is on the verge of diversifying food production, this initiative is necessary for government's intervention in reducing the food import bill by 25% by 2025. The Ministry of Health, through its Medical Treatment Department, has expended a total of $956 million from 2020 to present, assisting a total of 2,725 persons. Minister Dr. Frank Anthony, during an interview on Friday, noted that the number of patients requiring medical assistance is increasing. In 2020, 204 were assisted at a cost of $219 million.
In 2021, the number went up drastically because we were able to help about 1,518 persons. And this is different categories of diseases. So it's not just cardiac diseases, but the dominant amount of persons who got help from us were in the area of cardiology, needing stents and so forth. But there were other areas like oncology, dialysis. We helped quite a lot of people with getting monies to help them with dialysis payments. And some persons also wanted to get maybe an MRI done.
For 2022, so far, 1,006 persons benefited from medical assistance at a cost of $292 million. Dr. Anthony noted that a relationship with the Caribbean Heart Institute allows for patients to be referred to the institute while government pays for the service. However, while cardiac issues are dominant, there are other categories of illnesses that persons require treatment for, such as surgeries, dialysis, and MRI, among other services.
Anybody requiring such assistance can be referred to that department. There are some requirements, of course. You'll have to bring in what is your diagnosis, who's the doctor that is treating you. We'll have to evaluate whether or not we can do it in the public sector. If we can do it in the public sector, then we'll put you in the relevant clinic so that you can get that type of surgery.
However, if such services are not available in the public sector, the ministry can assist in accessing assistance in the private sector. Residents of Lenora and surrounding areas will soon benefit from services of an upgraded Lenora Cottage Hospital, which is scheduled to be recommissioned on Tuesday, August 9. The Lenora Smart Hospital is one of 5 hospitals being upgraded through the Smart Healthcare Facilities in the Caribbean project, through a collaboration with the Government of Guyana and the United Kingdom. Minister Dr. Frank Anthony said a total of $900,000 was expended by the government of the United Kingdom, while the Guyana government spent approximately $15 million Guyana dollars for additional works. The hospital will have 3 doctors and more staff will be added as needed. The ministry is also working to add more inpatient facilities at the hospital. The Lenora Cottage Hospital and 4 other health facilities in Paramakatoy, Lethem, Diamond and Mabaruma are all part of the project, which aims to make them more climate resilient.